While there are biological causes for depression, this is by no means the only factor which may contribute to this problem. Numerous studies have been published indicating that abnormalities in chemical activity may themselves be caused by other factors. While professionals may need to treat these issues in order to help a person stabilize their mood, it will not necessarily be a cure. Truly, medical research has made significant progress toward better understanding brain function, even identifying genetic anomalies that can make one susceptible to low moods. There are, however, factors other than biology that are involved with depression. In most incidents where the factors are not solely biological, depression is situational. Psychotherapist and TED Talk speaker Mel Schwartz explains, "Loss of a loved one, illness, and job loss create circumstances that are painful. Working through the loss is more healing than medicating the pain. It is essential to address the underlying causes and not simply suppress the symptoms. The difficulty is that, in our quick-fix mentality, we believe that if we suppress the symptoms, then all is well. Thus, when we find ourselves depressed and feeling alone and/or hopeless, we still have some choices available to us. Knowing which strategies can help shine a light of hope into what appears to be darkness can change one's life for the better. There are times when medication is an immediate need and can be taken subsequent to a qualified medical advice. But physicians also normally advise it may not be a long-term solution and may recommend lifestyle adjustments to help deal with the issue as well. Some of these will be addressed in this video. This is because for many sufferers, the severity or frequency of depression bouts can be lessened by engaging in certain behaviors or actions. As The Guardian reports in the article, "What is Depression and Why is it Rising?" a key reason for the continuing rise in depressive illness is that drugs do not necessarily cure the patient. Medications and various psychotherapies may be useful tools in the fight against depression, but there needs to be an active involvement of the patient to address, where applicable, elements of lifestyle and outlook that may be contributors to the problem. Clinical social worker Katie Hurley, writing for the mental health resource PsyCom in August of 2019, describes 5 common behaviors that will entrench depression. Each can be reversed. She writes, "People struggling with depression can also make lifestyle changes to help alleviate symptoms. It helps to look at choices and habits that can contribute to depressive symptoms to understand how to make healthy choices during the treatment process." Let us now examine some of the known behavioral or social factors that can contribute to depression. Inactivity. A major depressive episode can take away the pleasure and incentive in nearly all activities. The individual finds it difficult to motivate themselves to do anything, even to rise in the morning. This can be harmful to employment, education, and even close relationships. Often the depressed person retreats to seek solace, to seek refuge from a feeling of despair. Yet this reduces their ability to contribute, to achieve something, however small. The longer this goes on, the more hopeless the feeling can become, and the more difficult to resume engaging people and the essential tasks of life. While the sufferer may understand the need to become active, the despondency is often so deep that doing anything seems overwhelming. Thus, even a small change can reap major benefits. Researchers Kamal Choi and Jordan Smoller recently published a summary of their research in this area in The Lancet, entitled "Making the Right Moves to Prevent Depression in Young People." They state, "Adolescence is a key window of vulnerability for depression, the leading cause of disability worldwide. The prevention of depression among young people is therefore of substantial public health importance. A growing body of large-scale data now supports the conclusion that physical activity is associated with a reduced risk of depression." They looked at the idea that increased activity would serve to lessen the impact of depression on the individual. What they found was even that minimal light activity showed a significant improvement on the patient's mood. They continue. The good news from this study is the implication that light activity, which can include movements as simple as standing, stretching, or casual walking, might be an effective strategy for decreasing the burden of adolescent depression. According to the WHO Physical Activity Guidelines, adolescents should aim for at least 60 minutes of moderate to vigorous activity each day. Dealing with the issues at the heart of the depression may be too challenging to start with, but experts, including the ones already cited, recommend adding some form of physical activity, however minimal, to our routine. This can be as simple as a moderate walk outdoors. Many studies show exercise to have the effect of improving or elevating one's immediate mood. Other symptoms of depression are somewhat reduced. There are many types of regular activity, but walking for about 30 minutes a day can be of significant help. Studies show that regular walking, in addition to helping address symptoms of depression, reduces the risk of type 2 diabetes, heart disease, and serves to manage weight. Mild and moderate exercise stimulates the body to produce serotonin and endorphins. These chemicals, sometimes known as the feel-good hormones, help alleviate and control depression. Thus, becoming involved in some form of light to moderate daily activity can improve one's outlook on the world, and it also helps one get back into contact with the world around us in a safe and non-threatening way. It serves as one way to start gaining some control over anxiety and depression.
If you liked this video, please like, comment, and subscribe. And for more content like this, please visit our website at tomorrowsworldviewpoint.org.